Hello and welcome back to my channel. If you're new here, I'm Nurse Alyssa, a wound care specialist dedicated to helping you understand and manage all things wound related. In today's video, we're going to be talking about something you'll commonly see in chronic wounds: slough. We'll explore what it is, why it matters, and how to remove it to support proper healing. So what is slough? Slough is that white, yellow, tan, stringy substance that forms in the wound base. It's made up of dead tissue, bacteria, and cellular debris. It often appears moist and can cover part or the entire wound bed. Now, here's the problem. Slough acts like a barrier that prevents healthy granulation tissue from forming and increases the risk of infection. So before a wound can truly heal, slough has to be removed. Removing the slough helps the wound progress from the inflammatory phase to the healing phase, and it encourages growth of healthy tissue. So let's look at different debridement methods. There are several ways to remove the slough depending on the wound and the patient's condition. Here are the most common debridement methods. Autolytic debridement. So this uses body's natural enzymes and moisture to soften and break down the slough. We use moisture retentive dressings like hydrocolloids, and it's best used for patients with minimal slough and low infection risk. Enzymatic debridement. A topical enzyme like collagenase is applied to chemically break down the slough. It's selective and gentle, so it's great for patients who can't tolerate the more aggressive methods. Mechanical debridement. So this includes methods like wet to dry dressings, wound irrigation, or soft abrasion. This can be painful and non-selective, so it's not the ideal method of debridement. Sharp or surgical debridement. So this is done by a trained clinician with scissors, scalpel, or a curette to quickly remove the slough. It's fast and effective, especially for thick adherent slough or infected wounds. Biological debridement. Yes, we are talking about sterile maggots. They selectively eat necrotic tissue. It's highly effective, though it is less commonly used due to patient preference. Lastly, we have chemical debridement. Now, this isn't a commonly talked about debridement method, but it is actually one of my favorite methods. So products like Vashi Wash is a cleanser that fall into this category. Vashi is a hypochlorous acid-based solution that helps loosen devitalized tissue, reduce biofilm, and clean the wound without harming healthy tissue. It's especially helpful in reducing bioburden and preparing the wound bed for healing. Now, each method has its pros and cons, and it's important to choose the right approach based on the patient's health, wound type, and care setting. To sum it up, slough must go for healing to grow. It's a barrier to recovery, and choosing the right debridement method is key to progressing the wound through the healing stages. Thanks so much for watching. If you have any questions, please drop them below or suggest a topic for our next episode. Until then, stay safe, stay informed, and keep those wounds healing. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.